So hello friends, today we'll discuss about the previous year question. So here the first question is, in acquired immunodeficiency syndrome, the common cause of meningitis is Mycobacterium tuberculosis, Rhizosporidium parvum, Cryptococcus neoformans and Haemophilus influenzae. Okay, so here the option will be Cryptococcus neoformans because it is an encapsulated fungus and it has the high risk for the patients who are having an immunosuppressed state. So that too in the HIV patients, when the CD4 count is less than 200 microliter, it is an important risk factor. So also the patient with any hematological malignancies, any transplant recipient, or who is on the immunosuppressive or the steroid therapy. So second is the diarrheal disease in the infant is caused by Norwalk virus, astrovirus, rotavirus and the coronavirus. So here in the infant it is always rotavirus, whereas in the older children and the adult it is an norovirus. So coming for third question, what is the treatment of choice in the Gardnerella vaginalis? So option given here are clindamycin, metronidazole and erythromycin and the tetracycline. Okay. So clinda, metro, erythromycin and the tetracycline. Okay. So here the correct option is metronidazole. So if you want to remember, so one, it is an Amsel criteria. So that is there will be a profuse discharge within. Okay, that is will be an important factor, and then the pH will be more than 4.5 and there will be fishy odor which will be aggravated by adding with 10% of the potassium hydroxide, that is called as a whiff test, and there will be a clue test, clue cells, that is in vaginal epithelial cells which are coated with the cocobacilli. So if there is among the four findings, if there is any three criteria, it is tend to be in positive, and the Nugent score, that is it is by, so you will be counting the number of Gardnerella vaginalis and Mobilingus and Lactobacilli. Okay, so if it is more than 7, then it is a diagnostic. So here always remember the treatment of choice for the Gardnerella vaginosis is an metronidazole. So here you want to remember the two important points. One, it is an Amsel criteria, another it is the Nugent score. So that another test that is called as a whiff test. So coming for fourth question, the infection which is not transmitted to the blood. So option given here are HIV, that is a human immunodeficiency virus, hepatitis B virus, hepatitis E virus and prions. So the option is, correct answer here is hepatitis E virus. So what are the transmitted infections are HIV, HBV and human T lymphotrophic virus and the prions. So the last question is, anaphylactic shock is commonly associated with IgE mediated hypersensitivity, general anesthesia, diarrhea and vomiting. So always remember like you want to remember 3A for the IgE mediated hypersensitivity. Okay, so one, it is an anaphylaxis, second it is an atopy, another it is an asthma. Okay, so these three are associated with an IgE mediated hypersensitivity, and that is, it is in type 1 hypersensitivity. So already a question came on the type 4, right? So type 4 hypersensitivity, and here it is in type 1. So thank you friends.